When it comes to driving, general practitioners and other health professionals have an important role to play for people with dementia, their families and carers. Dementia involves a gradual decline in cognitive and physical functioning, which means that at some point the person will need to stop driving. It can be challenging to determine the point at which a person should stop driving, as everyone's experience of dementia is different. Difficulties with driving can be a sign of cognitive impairment. Be alert to any comments patients or their family members may make about problems with driving, especially if there is no dementia diagnosis. Undertake an appropriate assessment for dementia with patients who present with signs of cognitive impairment, and refer them to a memory clinic, geriatrician or neurologist. As a health professional, you can advise a person with dementia to reduce or stop driving, but it is the State or Territory Driver Licensing Authority, or DLA, which ultimately decides whether they can continue to hold a licence. Raise the topic of driving with patients who have dementia or mild cognitive impairment as early as possible. Advise the patient that they are legally obliged to notify the DLA and that they will need to stop driving at some stage. Reporting obligations for GPs and treating doctors vary from state to state. Check with your DLA. If the patient decides to stop driving, provide information about getting around without a car. Suggest counselling if they experience adjustment difficulties. If the patient wants to continue driving, check their ability. Are cognitive impairments severe and likely to impact on driving? Are there other medical conditions such as vision problems? If so, advise the patient to stop driving until the DLA makes a decision. Ensure that you document any advice, recommendations, and pre-assessment provided to the patient and any concerns from the patient or family. Once notified that a licensed driver has dementia, the DLA will request a medical report. A formal driving assessment may also be required. If the DLA decides the driver is fit to drive, a conditional licence will be issued. This licence will be subject to periodical review and may include restrictions such as driving within certain distances or driving in daylight hours only. The DLA can suspend or cancel a driver's licence. This decision can be appealed, but the patient must stop driving until the outcome is known. If a patient does not inform the DLA of their condition, remind the patient of their legal obligation. Where there is concern that a patient is continuing to drive despite risk or the advice of the DLA, consider making a notification to the DLA. It can be challenging discussing how dementia can affect a person's ability to drive, the legal issues involved, and the need to stop driving. Family and carers play an important role in supporting the patient stopping driving. With the patient's consent, try to include them in consultations and remember that patients, family and carers can be referred to Alzheimer's Australia for further information and support. For more information and resources on dementia and driving, including driving warning signs and a tip sheet on approaching conversations with patients about dementia and driving, visit www.fightdementia.org.au/dementia and driving.